Okay, well, this chat is part of the a series of interviews we're doing about dental specialties and what it's
Mhm.
like to become a specialist. And there's 13 of them in Australia. And one
Yeah.
of them is oral and maxillofacial surgery. And I'm absolutely thrilled to have Dr. Omar Breik here today to discuss what it's like becoming an oral maxillofacial surgeon. He's an oral maxillofacial surgeon in Brisbane, based in Brisbane. So welcome, Omar, and thanks for agreeing to chat to us. I really appreciate it. I know how busy you are.
No, thank you, Stephen. It's a pleasure to join you on this dental chat. So thank you for
Yeah.
having
So first of all, can you just, to kick things off, tell us a little bit about your current position, what you're currently doing, and then we'll go back and see how you got there in the first place.
me. Yeah. So at the moment, I'm in Brisbane, and I'm a maxillofacial surgeon with a subspecialty interest in head and neck cancer and head and neck reconstruction, and I work full time. Public, which is 4 days a week at the Royal Brisbane and Women's Hospital, predominantly doing cancer and deformity type surgery, and I do 1 day a week of private practice here in Brisbane.
Okay, now look, I've read a little bit about your background, but you've got a particularly interesting background from what I can see. So let's go right back to the beginning. Can you just tell us where you were born, raised, and how you ended up in Australia? And then we'll get on to the dentistry side of it.
Yeah, so I was born in Kuwait. I won't tell you what year, so you don't know how old I am. But in the mid 1980s, and
Mm.
but I'm originally of Palestinian descent. So Palestine's had a lot of troubles, and at that time, Kuwait was the kind of the the Dubai of that era. It was a
Mm.
thriving country. So my parents worked there. My mother was a dentist, and my
Oh, okay.
dad, yeah, and my dad was a telecom engineer. And then when I was 5 years old, the Gulf War started, and my parents had already escaped the war in Palestine. So by that point, they thought, we need to find a safe place for our three kids, and so we came to Australia. At that time, they were giving that you could come as a skilled migrant, even if you're and kind of where you're a skilled migrant and a refugee at the same time. And so we moved to Australia at that point. We lived in Hobart for a year, and
So
that
what
was
year was
amazing.
this?
This was in 1990.
1990,
Yeah,
right? Yeah.
1990. And then in 1991, we moved to Melbourne, and I grew up in Melbourne and went to Baldwin High School. And we moved around a little bit in between that time, but I finished high school in at Baldwin High School in Melbourne.
So, how did you find the transition to Australia? Did your family know people here, and how did you go with the culture, the language? Was it easy or was it difficult?
Yeah, so I guess when you're five, I didn't know any English at the time.
Mm.
We English is a relatively easy language to pick up if you're immersed in it,
Mm.
and so I don't think I didn't find it too challenging. My parents struggled a bit more than I did, and that's why this my dad especially struggled to get a good enough job that he was really happy with, and my mother was a dentist trained overseas, so she had to learn English and then try and sit the Australian council
Yeah.
exams. But we felt quite comfortable here in Australia very quickly. There was a lot of migrants that moved from the same place who were also originally of Palestinian descent. So we developed a community in Melbourne quite quickly and felt really quite at home. And we've loved being in Australia ever since. Really.
Well,
Yeah.
brilliant. So, you're in Melbourne and you've gone to school down there. What made you decide to do dentistry? I mean, I assume your mother, being a dentist, helped put the idea into your mind.
Yeah, so for a period of time, my mother did work when we moved. We moved back to the Middle East for a few years, and my mother did work. And we used to, after school, if there was nobody home, the driver would take us to my mum's clinic. And she worked in a big hospital at the time as the head of the department. And I'd go, and sometimes she'd get us to assist her and look after patients with her. And she had this beautiful manner with patients. So I just loved watching that interaction of a dentist with patients who are always quite anxious and and was quite proud of that, watching my mother help people in that manner. And when I was bored in her clinic, we used to go upstairs to the dental technician, and he was this lovely Egyptian guy who used to smoke cigarettes and make dentures or
Mm.
crown and bridge, and he would give me a block of wax and a plastic tooth, and he'd say, I want you to measure it and carve out that tooth from a block of wax at 2.5 times the size, for example. And that became, a little fun challenge for me as a young teenager. And I really enjoyed the materials side of things. And actually, somehow that's inspired my PhD 30 years
Mm.
later. But those things kind of probably had a lot to do with it. But, like everybody, when you get to year 12, you don't really know what you want to do. My best subjects were maths and physics. And so I was leaning towards the engineering side like my father. But he actually told me, I think you deal really well with other people. So he said, I would encourage you to go towards healthcare rather than, um,
Okay.
and so I applied to dental school and got in at the time.
Okay, well, that's amazing. My experience as a child with dentistry, no one in my family had done
Mm.
any. In fact, no one in my family had even gone to university. I was the
Oh,
first to
really?
go to university. Yes, but I
Yeah.
do remember when I was a child going to the dental clinic, and I actually clearly and vividly remember being in the chair and at some stage, and I don't know how old I was, thinking, who the heck in their right mind would ever do this job?
Yeah, yeah.
And now I didn't think about dentistry again for years and years later, but I do recall saying that, and it's funny how
Mm.
things work out.
Mm.
Amazing. So you went to dental school in Melbourne.
Yes.
In fact, it'd probably be good at this stage just to give us a quick overview of your studies from the moment you started dental school to when
Mm.
you could hang your shingle up as an oral maxillofacial surgeon, because, well, without doubt, it's the longest path to becoming a specialist in dentistry and probably medicine as well. So you can just quickly, we'll go and look at it in a bit more detail, but quickly outline
Mm.
the path.
Yeah, so I did 5 years of dental school at the University of Melbourne, and had a fantastic time there. And probably in second year is when I started getting inspired about to do maxillofacial surgery, and pretty much set my goals on that. And we'll talk probably about that later. And then, so when I finished dental school, um, I'm you had to work at least 2 years as a dentist before applying for maxillofacial surgery. Those days you could apply for the program before having done your second degree, and they kind of facilitated your entry into the second degree. And so I wanted to apply for the program, so I knew that I had to work at least 2 years in some capacity as a dentist. At that time, they had started a job at the Royal Dental Hospital in Melbourne called a specialist intern, knowing that I wanted to be a specialist. So I did that for a year at the Royal Dental Hospital and did some private practice on the weekends. And then I wanted to get more exposure to maxillofacial surgery. So I actually went to Auckland in New Zealand and worked
Mm.
there as a senior house officer in New Zealand. And then I got into the program, and that was in Adelaide. So I moved to Adelaide and did my first year as a maxillofacial trainee and started medical school at the same time. And that was a challenging year, but one of the best years of my life. And then finished med school at the University of Adelaide 4 years later in 20, what year was that? 20, end of 2012, and then
Mm.
worked as an intern. And then you had to work at least 2 years as a doctor. One of those years has to be in surgical specialties. So my first year was an intern at the Royal Adelaide Hospital, and then I did a year as a surgical resident where I did ENT, plastics, neurosurge, and orthopedics. And then I got back into the maxillofacial program at that point. Moved back to Melbourne, where I got in for my advanced years, did 3 more years of my advanced maxillofacial training in Melbourne, and then finished that at the end of 2017. And I wanted to do head and neck cancer surgery, which I got first encountered when I was in New Zealand and thought it was incredible. So I moved to the UK and worked for 3 years over there, a year at the Royal Derby Hospital, and then 2 years at the Queen Elizabeth Hospital in Brisbane, and Queen Elizabeth Hospital in Birmingham, and that's where I did all my cancer ablation, cancer removal, and neck dissection training,
Mm.
salivary gland surgery training, and my head and neck reconstructive training, and I finished that in 2020.
Okay, wow. That's such a simple little way to go, isn't it? A simple little path.
Yeah,
Actually, and that's why we met, of course, on the therapeutic
mm,
guidelines for the
that's right.
upcoming edition, the fourth edition, and no wonder they've got you there for your vast amount of experience and everything. How many years was that altogether?
That was 19.
19 years.
19. So it started in 2002 and
Yeah.
finished in 2020. Yeah.
Okay, wow. But
Officially, I was registered as a MaxFlex surgeon in end of 2017, but I still
right,
had that extra training, so I'm not too
yeah,
keen.
a lot of people when they look at specialties and they look at,
Mm.
okay, I've got to get through this few years, or I've got to do, in your case, all of this stuff and training and education, and then finally I'll get to the end and then I can start living. But I think it's so true that it's not the right way to look at it. It's not as though this all this training, all this experience, all these things that you've done and place you've been, that is the journey, that is the experience.
I tell that to every person I meet, every dental student or medical student who I approach at the moment who says, "Oh, it's too long. I'm interested, but I'm not interested to train for that long." Is that I think they're kind of missing the best part. The end point is not the be all end all. Actually, it's the journey that makes it really
Mm,
fun. So for me, in that time, the best example is the fact that I was at university for 2 undergraduate degrees was the best
mm,
part because that
mm,
meant university holidays, that meant traveling. I love hiking, so I did so many international trips in that
mm,
time. I worked in between, so I could make a bit of money to have all those hobbies. While a lot of my friends who finished their first degree and went straight into work were too busy working to actually enjoy
mm.
those aspects of life. So for me, the journey was the best part, and
Yeah, well, you were
it's
living
what I
your life.
crave now. And it's
Yeah.
actually what I crave now is to go back into
Well,
some sort of training.
yeah, you're actually still doing some study, aren't you? You're doing a
Yeah,
PhD.
I'm addicted. I'm addicted. So I think I really enjoy the gaining as much knowledge as I possibly can. So and giving back in whatever way I can. So at the moment, I'm doing my PhD at the University of Queensland part time while I'm working, of course, a bit more than full time. And I'm doing that on looking at alternatives to titanium for plates and screws and ligation clips and things like that. So I'm back to the materials science that I kind of first got
Like,
exposed to in the dental technician world. I'm looking at metals that dissolve in the body over time. So zinc and magnesium, iron, and alloys of those metals, or modifying those metals in certain ways to make them more more biocompatible, but also to make them behave mechanically in the best way possible. So that's a combination of in vitro work at the engineering school and animal studies at the same
so
time. So
you're
it's
actually trying to
quite fun.
find metals that will resorb, so you can put these screws in, so they're not there for the rest of the patient's life. So they actually resorb. Is
Exactly,
that what you're well?
because 30% of all orthopedic operations, not as much in MaxFax, but 30% of
Mm,
all orthopedic operations are actually removing hardware that they put in to fix a broken bone. Because after 6 weeks, the bone is healed. After 3 months, it's matured to the same strength that it should be before the injury. And actually, the plate then becomes either a source of infection, a source of discomfort, or actually can affect the bone's ability to mature. Because if it always has something bearing the load, then that bone will never be quite as strong as it is if it's bearing the load itself. So it's something called stress shielding. So, or in children, for example, we automatically remove the plates after 3 months, even in the head and neck, because they can impair healing and they can
mm.
impair growth in these people and in children as well. So if we can find metals that dissolve after 6 weeks or 12 weeks or 18 weeks or even after a year, that's a much better thing than having titanium sitting there for all of its life. And some of these metals that dissolve in the body actually have antibacterial properties and bone regenerative properties as well. So they have other benefits to the healing bone than just holding it together while it heals.
Okay, well, that's amazing. That's
Mm.
incredible. I want to just backtrack a little bit. So
Mm.
you finished your dentistry, you did a couple of years. You said you actually, at that stage, knew you wanted to do oral surgery
Yeah.
and maybe maxillofacial surgery, and you went to New Zealand. I actually spent a year and a bit in New Zealand back in '97. That's where I did oral surgery at
Yes.
Dunedin. And
Yeah.
but I was surprised. You mentioned being a house, well, I think they call it a house surgeon or something like that.
Hmm.
I was surprised that people first year out the stuff they got involved with in the
Yeah.
hospital. I mean, it was quite, they were into the thick of all kinds of surgery
Mm.
at that stage. Did you find that there was a difference between Australia and New Zealand in terms of what they got into?
Well, I just think dentistry is much better integrated into the overall healthcare system, the overall public healthcare system in New Zealand. So every major hospital has a big oral health center and unit, which I thought was incredible. And that meant you had exposure to maxillofacial surgery, but you also had exposure to special needs. We had great oral surgeons there who we could work with, who were fantastic, providing a constant service. We were even doing ward rounds with cardiothoracic surgeons for their patients prior to having a valve replaced, would get a dental assessment by a dentist who works in the hospital and could treat them within that hospital and get them prepared for
Mm.
surgery. I thought that was, the service that they provide in New Zealand, the dental service that they can provide in the public sector is second to none. And in
Yeah.
Australia, we haven't quite integrated dentistry into the healthcare system well enough, I think. Some hospitals have it, but I'd say probably the vast majority of Australian major hospitals don't have a dental unit at all.
Yeah.
And so
Look,
that's why I chased that
yeah,
experience.
I agree with that because that's
Mm.
what I found is integrated or was, and the exposure that first year and second year dentists got in the hospital, public
Mm.
hospital settings was incredible. Let's go back to medical school. Now, we've already talked about how long you have trained to get to where you are. One question that people often have is how
Mm.
the heck do you support yourself financially during dentistry and then medicine? Do you have part-time jobs, or is it just that parents are able to help, or what?
Yeah, so my parents were well, did well, but they weren't very well off to be able to kind of fully fund everything. But I've had the most incredible parents who've supported me the
Mm.
whole way, despite me obviously taking a very, very long path. But during dental school, I got a job as a translator for a research company. There's a called Roy Morgan Research, and so if they do all these phone surveys for the government research, and if they called somebody who's only Arabic speaking, they would have to get an Arabic interpreter. So I became an interpreter for them. And that was really good part-time work because they'll just give me a list of numbers I have to call and tell me, come in whatever times you want to our call center and you can make those calls. And that was in the middle of Melbourne City. And I lived in college at the time. So I used to just catch a tram, go and do 2 or 3 hours of work a week. And that actually supplemented my allowance really well. And I tried to do more leadership roles during dental school as well at the college. So I became the president of the college I lived in, which meant cheaper accommodation. So that helped my dad out a little bit and made it a little bit easier to fund. And then when I finished dental school, it was a lot easier because you can work as a dentist. And I saved money in my first couple of years when I was working, and then when I got into medical school, I worked part time with a maxillofacial surgeon in Adelaide, and I used to work in her practice just doing wisdom teeth, and I used to do half a day a week of clinic, and I used to do a Saturday list in the morning. She was very kind to me, Janet Scott, and she was very open to me even exploring and improving my skills, and sometimes come to theater with me to help me with trickier cases, and it was a perfect learning opportunity. But also supplemented my income and gave me money to travel in my holidays and not have to worry about supporting myself too much.
I think it's fantastic you mentioned Janet there, and a
Mm.
lot of people have people that they remember, lecturers or people who employers or whatever, who really made a difference in their life. And you mentioned earlier on that one thing that you're really interested in now, and so am I at my age, and getting, as I say, I'm a lot closer to the tomb than the womb. So that I really want to, you reach a stage where you really want to help. You just want to give
Mm.
back. You've enjoyed life. So it's great to hear that you had that experience too. And I assume that you've had that multiple times throughout all of this
Yes.
training. Yeah.
The one person I'd also want to shout out to, if I can, at this phase of my training, and you're 100% right. And there's also certain people who impact you even for a short moment, but could completely
Mm.
change the direction of your life. And it was the person who even inspired me to do maxillofacial surgery was a professor in Melbourne called Dragan Grubor, who's a Serbian migrant to Australia, did all of his training in Serbia, but during the war escaped and came to Australia, had to redo dental school and his oral
Wow.
surgery training. And he was the lecturer at the University of Melbourne. And he gave a talk once after hours at one of those specialty like exposure evenings. And he showed us all the trauma cases from when he was in the war and what he's doing now. And I was just absolutely inspired by that man. And that was the day that I decided this is what I want to do for the rest of my life. And that changed the next 30, well, 50 years, hopefully, of my life. It's incredible, those moments, isn't it? And
Yeah.
the effect
And
it can have.
you wish and hope that you can do the same for others as well.
Yes, every
That's
day,
inspiration.
every day.
Absolutely amazing. Now, look, some questions that people sometimes have about oral maxillofacial surgery, because it's kind of outside most specialties that we have, because it's, and correct me if I'm wrong, it's a dental specialty, but it's also a medical specialty. Well, can you tell us about that? And I think you've mentioned before that you have to pay two lots of APRA rates. Is that correct?
Yes, that's right. So maxillofacial surgery in, I think it was in the late 90s, suddenly in most parts of the world required that you have a dental degree and a medical degree. And that automatically changed the whole environment of the specialty, and also changed the respect that came with the specialty. So when we were in the big hospital settings, trying to do facial trauma, for example, there was a lot of pushback arguing that we're just stethoscope wielding dentists. That's what they used to call it. But introducing medicine, into the training program changed the mentality of how people saw the specialty. But it also meant, and it made it into a registrable dental specialty, but also a medical specialty, which does come at one sacrifice, which is you have to pay two lots of registrations every year. But also you're under the legislation of two different kind of boards within APRA as well. But by making that transition, to be honest, it hasn't initially changed a training program so much. And I'd like to show my respect and admiration for those who were singly qualified maxillofacial surgeons who brought the specialty forward, who had the same skills, if not in some ways better than we do now, who were incredibly well trained just with a dental degree. So I don't actually believe the medical degree makes you a better physical operative surgeon. Actually, most of our hand skills came from dentistry. Anyway, you don't learn any of that in medicine. It's more that it changed where we sit within the framework of the medical fraternity, and in turn helped improve our scope of surgery, and has taken us to the point where we can do our own microvascular reconstructions, where I could take someone's fibula bone and reconstruct their mandible and plumb it into the blood vessels in the neck, all on my own without needing any other specialties involved. That would
Yeah.
have been very hard with just a dental degree alone.
Yeah. Historically, I think most people, if they wanted to become an oral maxillofacial surgeon, did dentistry first, couple of years, then did medicine, and then went on with it. But it can be done the other way.
Yes.
Yeah, and people, I think you were talking earlier on about percentages of
Yeah.
people.
When I first started, it was it was probably 80 to 90% of applicants for maxillofacial surgery had done dentistry first and then would do medicine after. But now I think we're getting much closer to the 50% have done medicine first and 50% did dentistry first. And that's been really, really good for the specialty because it brings different perspectives and attitudes as well. And so, just looking at the Royal Brisbane department that I'm in, out of the 7 or 8 consultants that we have, about 4 of us had done dentistry first, and the other 4 had done medicine first. So actually, it's exactly 50-50 within our team at the moment. And our head of department, Martin Batstone, did medicine first and was one of the early ones who had done medicine first. And he pushed things forward with just because he was just an incredible surgeon, but also an incredible doctor when he first finished medical school as well. And
Right.
so I think it's been a very good thing for our specialty to attract people from either side first. And my biggest concern probably is that we're slightly losing young dentists from being interested in the specialty because it's so long. And so, I spend more time with the dental students that we have visiting our department, trying to convince them, but we actually can easily convince the medical students to get inspired by maxillofacial surgeon to go and do dental school. It's harder to convince the dentists to do medical
Well,
school
that's
these days.
interesting. Yes. Yeah, I would have thought it was the other way round, but that
And
is
despite
amazing.
all those other specialties around, they still come and join our department and feel, wow, this is an incredible specialty with the whole gamut of surgery. Because we're not just hard tissue surgeons, but also soft tissue surgeons and treating peripheral
Well,
nerves, etc.
I suppose that leads us into where you've kind of subspecialised into head and neck cancer. And I think you said that you do 4 days in the public and 1 day private, but your 4 days in public are pretty much towards head and neck cancer. That to me would be a draining emotionally kind of area to get into. I mean, it obviously has massive pluses as well, that what you can
Yeah.
do to help people. But yeah, talk to me about just the emotional toll, and I assume that there is.
Maxillofacial surgery, I love the whole gamut of the specialty, and what makes it so beautiful is that it's got so much diversity to it. And so most of my private practice is dental, wisdom teeth, implants, orthognathic surgery. But what I felt was slightly missing from those parts of maxillofacial surgery is they're often one-stop shops. And so, you see the patient, they have their wisdom teeth out and they go. They have their implant, you see them for their osteo check, and then they're going back to their dentist or prosthodontist and they're gone. And I felt one thing I wanted was a bit more of that longer term patient contact, and that does come at an emotional toll. And so that's why, well, one of the reasons why I pursued the cancer side of things. And so I went into the head and neck cancer and reconstructive pathway, and I did it initially because it's a amazing skill set to be able to have. It's a very very broad area of surgery. It's really refined surgery. Part of it is done under a microscope to connect blood vessels to each other. The rest is, and you're operating all over the body. So there's a real joy in the skill that you acquire. And helping people with cancer is an absolute joy, and real, and feels like real life saving surgery. But it definitely comes at a toll. And I think I have too many gray hairs for my age, and part of the reason is cancer surgery. And just in the last few weeks, we've had very young patients. One under the age of 20 who we had to do a subtotal removal of their tongue and reconstruct both sides of their neck had to be dissected, and we reconstructed their tongue with their thigh. He'll always have trouble with swallowing, always have trouble with speaking. And these are patients who I'm going to see for hopefully years and years to come. But that also means we see the cancer's coming back, and we see patients losing their lives and losing the battle. The emotional toll of that is feeling, is there anything I could have done differently? Or the sense of the feeling of not necessarily guilt, but the feeling of how could I have done anything differently to have saved this person? And that's really, really hard. And I have to be honest with that. That has a big toll to play on me.
It's kind of an incredible area to delve into. It's so much responsibility. In that area of head and neck cancer and head and neck surgery in general, there's often turf protection and whatever. Do you ever bump up against plastic surgeons or ENTs? And, is that kind of, there's no problems there? Or do some people tend to say, well, you're venturing into our area?
Oh, there's no doubt that, like in every field, in every, not even just in medicine and dentistry, but everywhere, every kind of profession, there's a lot of politics. And in medicine and in head and neck cancer, classically in Australia, if we look back 30 years ago, an oral surgeon or a maxillofacial surgeon would biopsy the lesion and send it to an ENT surgeon, who'd then remove the cancer, and a plastic surgeon would reconstruct it. And that's how it was even during my training in Melbourne and in Adelaide when I was there. But things have changed. And part of what we used to see with that was that, there was no there was no complete continuity of care. A lot of these patients never got rehabilitated because teeth were not the priority. Do you know what I mean? A lot of these patients had bones, their mandible reconstructed, but there wasn't the finesse to say, well, I want to place this bone where they can be rehabilitated to have implants in the future, and then hopefully teeth so they could chew and eat and function. There was more of a let's get them through this operation and go from there. So when I was going through my training, I felt that there were so many deficiencies in our overall care of head and neck cancer patients. And what I felt was the reason was that it was so divided between so many different specialties. And in the process, nobody really takes complete ownership over a patient's care. What I wanted to do is train in all of it so that then I could be the one who's removing the cancer, reconstructing the cancer, and rehabilitating those patients. There's definitely turf issues, and at the Royal Brisbane, we've been doing it for a very long time, thanks to Martin Batstone's progress. And so really there's very little drama here. In fact, I do a lot of the reconstructions for the ENT surgeons. So if they have an oral cancer to remove, they often call me to come and reconstruct that patient. But there's still turf wars, especially in other states, and different hospitals have different levels of that. Ultimately, I think if you're good at this work, you should be allowed to do this work regardless of what specialty you're in, and we should be working together a lot more, as my personal perspective.
Yeah, no, you've answered a lot of the questions I've had in my mind because, I predate you in terms of dentistry and life, I suppose. But I do remember there being, as far as head and neck surgery, that was always ENT. And I do remember plastic surgeons going through a period of having real problems with maxillofacial surgery.
Yes.
But that was decades ago, and it's good to hear
Mm.
that that's fairly well being sorted out. Not completely,
Yeah.
but to a large extent.
I think, definitely. And I think everybody seems to respect that each have this. So I sometimes call plastic surgeons to come and join me in surgery if I think they're
Mm.
going to bring an element that I might not be able to see as well. And they often send me patients that they've reconstructed that they're like, look, can you figure out a way to dentally rehabilitate this person? Do you know what I mean? And so, despite doing a lot of cancer resective and reconstructive surgery, most of the implants I do are actually in the public sector as well, trying to rehabilitate our cancer patients and give them
Mm.
their function.
Okay.
And that's very much a teamwork approach with other specialties as well.
Okay. Well, for those who are interested in the oral maxillofacial route, could you just kind of explain to the viewers what's your average day? I know that you have 4 days public, 1 day private, but what's that kind of an average day look like to you? Because one of the best things to determine if it's suitable for you is to actually look at someone who's there and is doing it. So
Yeah.
run us through, kind of what time do you kick off and finish, and I suppose you're on call as well.
Yeah. Do you mind if I just go briefly through last week, for example?
Go for it. That'd be
Yeah.
perfect.
So last week I started at 8 a.m. on Monday in private, and that was at a private hospital. I had 7 cases on that list, 2 of them for general implants and 3 sets of wisdom teeth, and that was nice.
Mhm.
4 sets of wisdom teeth, and then had clinic all afternoon in private as well, seeing new patients, follow-ups, etc.
Mhm.
Tuesday, I had my cancer clinic in the morning, which is usually starts at, well, my Tuesday starts at 7 a.m. We do a ward round on all of our patients who are still in hospital at the Royal Brisbane. And then at 8 a.m., at 8:30, my clinic starts. And that's my main cancer clinic for the week. And there's usually about 35 to 40 patients in there. Some of them new, some of them follow-up cancers, as well as orthognathic patients that have been referred to me. And I also do a lot of the hypodontia cases. So people born with congenitally missing teeth. So I see a lot of them in those clinics as well. In the afternoon that particular day, I went to the ENT theater because for that young patient they were just about to finish removing the cancer, and so I helped them do the resection of the tongue. They'd already done the neck dissections, and I started harvesting the thigh reconstruction so I could reconstruct the tongue with that. Finished that day at about 6:30. Finished reconstructing the tongue, and then went home, put my son to sleep because I try and make it to bed and bath time. I've got a 1-year-old at home. And then the next day, 7 a.m. again, all day theater. It's my colleague's theater day. So I just come in. So he had a cancer patient on. My job was to kind of help with harvesting the fibula free flap reconstruction for a jaw. For a jaw reconstruction, and then I closed that with one of our medical students. And then in the afternoon, I actually had rat surgery for my PhD. So I was implanting these tiny zinc clips into the inferior epigastric vessels of rats. Finished that at about 5 o'clock, went home. The next day, 7 a.m., all day theater. We had a patient with osteoradionecrosis where his mandible from previous tonsillar cancer was treated with radiation, and part of his mandible had died away, unfortunately. And it was actually coming out of his neck, and he was getting on and off infections, saliva leaking out of his neck. So we removed that segment of the jaw and reconstructed him with his fibula bone as well. And the fibula vessels had to be connected to the other side of the neck because that side was too irradiated, and so it couldn't really get to the blood vessels. It was too scarred. That was a challenging case because he had a lot of peripheral vascular disease, so connecting the blood vessels was really difficult because of all the atherosclerosis. Finished that at about 6 as well and got home. Friday, we had 7 a.m. start, see all of our patients again. Head and neck cancer multidisciplinary team meeting, which goes till about noon, where we present new cancer patients. We present the results of our most recent operations and decide on whether they need what kind of treatment they require or if they need any adjuvant treatment. And in the afternoon, we just had admin to kind of look after the rest of see our ward patients again and tie off any loose ends for the week and head home. And that was my week this week. So, yeah.
I'm exhausted just
Yeah, I was
listening
exhausted.
to that. I mean, that's intense. That's a lot of work. Are you on call as well at any stage?
Yeah, so not this particular week. In Brisbane, we're quite lucky. The on-call, we have about, I think it's 14 consultants in the public sector between all the Brisbane hospitals. So we're only on call 1 in 6 or 1 in 8 weeks. So it's not that frequent.
Oh,
And
that's
so,
not too
yeah.
bad. Yeah, okay. Well, that all sounds amazing. Now, outside of all of that,
Mm.
that stressed environment and the emotional toll, what do you do to relax? How do you keep some kind of life work balance? I know you've got your 1 year old son who's
Mm.
the light of your life, and
Yeah.
probably changed things a lot a year ago when you had him. But what do you do to keep a balance?
Yeah, so before Adam, my son, came along, because he's my first child, so I never had kids before that. Sport was my main way of unwinding. So I played soccer every Sunday with a team on Sundays between 4 and 6, and I used to play a lot of tennis with my brother-in-law, who's much better than me. So that killed any ego that I could have possibly had. And because he just beat me every single week. And I try and keep myself somewhat fit. I enjoy hiking, and we recently moved into a house where we're right next to Mount Cootha. So right at the end of our street is a lot of the hiking tracks. So I do a few of those a week at least. So that's at least 4 to 6 kilometer hikes a few times a
Oh,
week, which is fantastic. Since my son came along, to be honest, I don't think I've ever experienced that kind of unwind or that kind of suddenly forgetting everything else that's going on in
mm,
your life the
mm.
minute I see him. I do. You can see I try and get home at a reasonable time, despite doing big reconstructions, because he is my joy at the moment. And so every minute I can be home, I am, and I work hard to try and get that time with him. And so this weekend my wife's studying because she has her orthodontic exams coming up. So I've got daddy daycare all weekend, which is the best. And so I'm really excited to.
Yeah,
Yeah,
well, look,
so that's how I unwind at the moment.
I've got three children, and
Yeah,
it was just fantastic. They're all a lot older now, obviously, and
yeah.
moved out of home. But I do recall I was their soccer coach for all of them.
Oh,
Over a period
really?
of about 12 years, it was the best part of my life.
Yeah.
Absolute best part. Winding down, being with them, their
Mm.
friends, going to the games on the weekend. It was
Yeah.
just magnificent time. So I'm so happy for you.
Yeah. No, thank you. I'm really excited about. I might call you about what it's like to coach soccer and give me your tips and tricks because I'd be really excited to do that.
Okay, well, look,
Mhm.
thanks so much for all that. Now, the last thing I'd like to ask you is what advice would you give for someone who is thinking this? Maybe we've got a dental student watching or a young dentist who's thinking about going down this path. We've kind of covered some of the things, like make it the journey as you go through, but yeah, what
Mm.
advice would you give?
So my advice would be that, well, hopefully we have a long career ahead of us, right? And so it doesn't really matter how long it takes to get to that point. My what I would advise people is to find something that makes them excited, that makes them passionate, that makes them think, you know what, I don't just want to do this career. I want to make a difference in this career. I want to enhance people's experience of this career. I want to, you know, I want that to be the gift that I leave behind after my death, right? And when you find that, no matter how long that thing's going to take you to get to, or how many hurdles it seems it's going to be, my advice would be take it, because the truth is, otherwise our career can be really boring. And what I hope is that my passion and joy for it also becomes an inspiration for my son, something for him to be proud of. It becomes a legacy that I can give to the students that I work with, to the patients that I look after, to the people that I hopefully bump into and inspire along the way. And I hope it makes it all worth it. But ultimately, find what makes you passionate and enthusiastic and chase that. And that would
Okay.
probably be my main advice to people.
Yeah, it's so true. Well, look, Omar, thanks so much. I think we've given everyone a good description of what it's like to get, from woe to go to become an oral maxillofacial surgeon, what the average day's like, and kind of what type of things you do. So I think that will be very helpful. So thank you so much. And I must say, it's been an absolute pleasure meeting you on the therapeutic guidelines.
Yeah, you
You've
too,
contributed
Stephen.
so amazingly, and it's absolutely brilliant. So.
No, it's been really fun. And Therapeutic Guidelines is an incredible publication. I feel very honored that they even contacted
Mm.
me about it, but even more honored that I work with such a fantastic team on Therapeutic Guidelines. So it's
Yeah,
been
they're
a
great,
pleasure,
aren't they?
and I look forward to working with you a lot more over the years.
Okay. Well, thank you, Omar, and have a great weekend.
Thank you, you
Bye.
too. Thank you.